A man at the helm of one of Bahrain's trusted private healthcare service providers, the KIMS Health GCC. One who shapes the group's strategies on quality healthcare across the region. Jacob Thomas, Group Executive Director, Operations and Projects GCC, Board Member and Investor, KIMS Health GCC. Mr. Jacob, a resident for the past 15 years, is in charge of the operations and the expansion strategy of the health group. A man instrumental in the growth of KIMS Health GCC over the past 14 years in the region, comes with over 22 years of pure healthcare experience, during which time he served in many key operating roles. Prior to joining KIMS Health, he was associated with the Apollo Hospitals Group in their projects division and ran his own boutique healthcare consulting firm, Critical Health Systems and Services, in Bangalore, India. With a master's degree in hospital management from the Apollo Institute of Hospital Administration, Hyderabad, after his graduation in science, Mr. Jacob is a member of the American College of Healthcare Executives. Well versed with healthcare delivery systems across the GCC and within India, as well as Bangladesh, Sri Lanka, Pakistan, South and Southeast Asia, and North, East and West Africa, Mr. Jacob believes on the principles of focusing on patient safety, patient experience, and innovation through application of emerging technologies. The father to two hails from Trivandrum, the capital city of God's own country, Kerala. Joining us on BizTalk from BMC Global Live tonight is Group Executive Director, Operations and Projects in GCC, KIMS Health GCC, Jacob Thomas. We are living in a time which taught us the importance and necessity of good health. The pandemic has tested even the best healthcare systems across the world. In such times, a brand that stood up to the trust of the masses, KIMS Health Group. Joining me this evening to share with us the group's success saga is KIMS Health GCC Group Executive Director Jacob Thomas on BizTalk from BMC Global Live. Good evening, Jacob. Welcome to the show. Thank you very much for taking time to join us.
Thank you, Raji. Thank you for having me on the show.
Great. So BizTalk is a show which features success stories of business leaders. I know you're a mixture of a businessman and an executive, and you represent a brand which has, as I said, earned the trust of masses in Bahrain and a very crucial sector. Tell us about the success story. How do you rate the success of KIMS Health?
Yeah, I think KIMS had very humble beginnings in Bahrain in 2004. Our group chairman, Dr. Sadullah, worked in Saudi Aramco as a clinician and an administrator. 27 years of his life, established KIMS, which was a tertiary care hospital back in India in 2002. And with the familiarity he had in Bahrain, he came back to Bahrain and thought of starting something in the GCC. And he met with Mr. Ahmad Jawari, who is our co-founder and main partner from Bahrain. And together they thought and applied for a medical center license. And we were fortunate enough to be one of the first private medical centers in Bahrain. And 2004, we opened it, and the rest is history.
History, yes.
And the success in Bahrain was quite an impetus and encouragement for us to look at a more structured way of growing in the GCC. So 2007, we gathered together, we set up a holding company here in Bahrain and also a management company. I was working with KIMS as an independent healthcare consultant, and then we decided to join together, and I came in as an investor, a board member, and a full-time director of operations at that time to set up a team that would spearhead this expansion in the GCC. And over the last 15 years, from 2007 to now, we have established 15 more units. So total we have 16 units in the GCC, 5 countries, and it has been a remarkable growth. And we have also been successful in communicating purely what we believe in values, our values, which is compassion, transparency, ethical treatment, and which is provided in a high quality environment. And that's what I think makes us successful, and both successful in terms of as a business, also in the eyes of our patients who can trust us.
Right. Yeah. You just mentioned in 2004. I still remember KIMS came in as a, I would not say relief, but then it was an option, much desired option, isn't it? Because at that time, other than the American mission, a couple of Bahraini hospitals, we did not have, especially the expat population of this country, the lion's share, did not have an option. And that's when KIMS came in. And now the scene has changed. We have many more players on the ground, isn't it?
Yes.
How do you see the competition?
I personally, I am one person who sees competition as something that is encouraging. I mean, it is an opportunity for us to sharpen ourselves and try to be different. I mean, that's the only way in which you can stay ahead of competition. I always tell my team, competition should catch us by the tail. So we should constantly innovate.
Especially in this field, isn't it?
Yeah. Constantly innovate. And what in healthcare, what is more important is communicating the value, communicating the trust. If people have the trust, it's not like any other business that they have options for. You are trusting healthcare option with your life.
Your doctor and your hospital matters, isn't it?
So that is where we have been able to stay, relevant to people's minds.
I just said about your hospital and your doctor.
Yeah.
With more players coming on the field, doctors also started moving from one place to the other. How do you see that trend or the tendency in Bahrain?
I mean, any organization, be it a healthcare or any other organization, is a collection of people. I mean, as in the success of an organization is the success of the team. I mean, how well the team is aligned to the organization's objectives. So, just by having a brand, it's not just enough for you to deliver everything that you are promising to give. The people also need to be aligned. And that is where I guess KIMS has been also successful in terms of aligning the objectives, aligning everybody to the objectives of the organization. We are good employers, and I think with all the movement that has happened in the market, I think we had the least movement of doctors. In fact, a lot of doctors from the market has joined us, and very few have left us. And so.
But do you see that as a healthy practice?
It is okay. As somebody will move because I feel we are not able to satisfy a certain part of its requirement, and I don't think we should throttle that.
Yes. Okay.
And it is also an opportunity for us to look for somebody better or somebody else. It's
different.
a fresh.
Fresh. Jacob, you represent a sector which has come in the spotlight in the past 2 years. A very crucial sector, isn't it? The pros and the cons, the plus and the minus. A lot of things changed. Unlike the other sectors, which could adapt quickly to, say, technology, like for example, media, or, for example, education. We could all move quickly to a platform, virtual platform, and things like that. But health was something different. It needed a specially tailored pattern. As a person, as a veteran who is heading a group like this, a private sector, what are the challenges, and how easy was this adapting to the scenario?
I guess like any other sector, healthcare was also badly affected by COVID,
Yes.
at least in the initial phases, when everybody kind of stayed at home and they were not sure whether coming to the hospital was
Safe, yeah.
But then we as a group were quick to regroup and look at how to adapt to the change scenario. Our costs were going up, especially because all the requirements for infection control that didn't come in.
Yes. Mm.
And uh, and
The situations, of course, you said about the cost, isn't it?
yeah, costs were going up, and yeah, I mean, in terms of yeah, so COVID really changed a lot of things for us. Our costs were going up, and
the cost aspect definitely is one thing, because I think there were a lot of protocols set in, especially for the sector. So I can understand that. But at the same time, people were reluctant to come to the hospital.
People were reluctant initially to come to the hospital, but then we had to reinvent ourselves. We looked at various opportunities that came along with COVID. Especially COVID testing was something that was an opportunity for us, which we immediately harnessed. And that kept us going for some time when the other things were going slower. But then the different waves of COVID were happening.
The variants.
So I think COVID is kind of settling down. There were a lot of people who delayed healthcare primarily by not going to the hospital, which came back in a more critical situation. So those challenges are going on. Actually, we used to have a lot of outpatients before versus lesser inpatients.
Inpatients, yeah.
Now we see a lot more inpatients and lesser outpatients. And I think COVID has actually pushed the outpatient actually in terms of going closer to homes. Outpatient care, especially with the digital advent. You have telemedicine, you have consultation happening at home, you have home care happening, you have a lot of digital devices which does lab tests and all these things at home. And so I would foresee in the future hospitals will largely be relegated to emergencies, advanced diagnostics,
limited to that, isn't it?
ICU care, inpatient care, surgeries,
yes.
and routine.
That's a great point, in fact, and you are a veteran who would be able to speak more on that. Let's go for a short break and come back to discuss this very crucial point. Yeah. And joining me this evening on BizTalk from BMC Global Live is KIMS Health Group Director Jacob Thomas.
all your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
And unspoken.
Welcome back to BizTalk from BMC Global Live, and tonight with me is Jacob Thomas, the Group Executive Director of KIMS Health. Jacob, we just left a very interesting topic of discussion. I'm interested to hear more about that, the future of the sector. You said it might be limited to emergencies, though we see COVID settling down.
Yeah.
People have been getting used to, I would say, being pampered to home consultations.
Yeah,
Or how do you, let's talk a little about that.
I mean, it's too early to say that.
Yes.
But there's a lot
But
of...
still possibilities are there, right?
People there's a lot of advent of digital techniques that is coming. There's a lot of experimentation that's going in terms of wearables, the things that people are talking about, lab in a chip.
Yeah.
You have continuous glucose monitoring that's happening right now. So a lot of things that required people to come to the hospital on an outpatient basis probably would not happen. And it would come, be at home or closer to home. And hospitals would be more for more serious issues in terms of probably emergencies, admissions, inpatient care, ICUs, surgeries. So this is what we are forecasting, I mean, in terms of, but at the same time there is a lot of, increase in non-communicable diseases. So level of care also needs to be higher in hospitals. So we are yet to see what's going to happen, but I foresee a lot of things happening from the comfort of homes.
Right.
Especially the millennials that are,
Yes.
I overheard a conversation between my two children. My son had a pimple and my daughter was asking him, probably you need to see a dermatologist.
Okay.
So he was saying, yeah, I'm seeing a dermatologist. At that point I looked, I didn't even know he was going to a dermatologist. He said, yeah, I'm consulting a dermatologist in TikTok.
Okay.
So, but I guess that's
a future.
Okay. What's going to be the future.
Right. And how do you look at it from a businessman's point of view?
I guess, we'll have to find, look at revenue streams in terms of what we can have it within the hospital, what we can take home.
Okay.
In whatever, in the digital advent, what we can be part of.
Right.
So, we are yet to see, we need to
explore further.
Yeah.
Right. Okay. And KIMS is one, you just said, started with humble beginnings in 2004. Now it's 16
units.
16 units.
Yeah.
It includes a hospital?
Yeah, hospitals as well as medical centers.
Medical centers. One hospital?
No, we have two hospitals in Bahrain.
Okay, one is
Royal Bahrain
and the other one is the one...
KIMS Health, the new KIMS Health.
The new one in Hassan. Okay, so these are full-fledged hospitals.
Yes.
And
We
other
have a
13 centers?
We have a similar hospital in Oman.
Okay.
Yeah, so we have 3 hospitals and the remaining 13 are medical centers.
Medical. And in Bahrain, how many medical centers do you have?
We have 5 medical centers.
One in Muharrak?
One in Muharrak, one in Hassan, one in Askar, one in Hassan.
Yeah.
One in Janabia.
Yeah.
Yeah.
No, 5, right?
Yes.
Janabia, Muharrak, Askar, Hassan, and Rafa, you mean?
Yeah, no, one is coming in Sitra.
That's what I wanted to say. The latest one, which is
We opened one in Janabia, the one is coming, and the new one is
in Sitra. So it's like going across Bahrain, isn't
going
it?
across
Catering
Bahrain
to the.
and looking at a hub and spoke model for each of the business models that we have.
So these are clinics,
These are clinics.
like from morning to evening.
Yes.
And then the two hospitals are
24 hours.
24 hours. In between, you also had come up with this proposal for having elderly care facilities. Isn't
Yeah,
it?
it was not purely an elderly care facility. It was a post-acute facility and rehabilitation. So there are a lot of people who can be taken out of the hospital, but are still not ready for home.
Okay,
So these
yes.
are intermediate care facilities.
Okay. The interim
Probably
care.
somebody who had an accident or probably a stroke. You know, he's finished the hospital requirement, but he's not ready for home yet. So this is called a post-acute facility.
Yeah. Okay. And what about your specialities? I think you have almost all the specialities, isn't it?
Except you know, we are not having cardiac thoracic surgery or interventional cardiology. We have neurosurgery, but not very advanced neurosurgeries. We don't have oncology.
Okay.
Yeah.
Okay. All right.
So these are some of the opportunities that we are looking at.
Okay, so that comes to my next question of the expansion plans of your group in Bahrain and in GCC.
I mean, in Bahrain, we are looking at Royal Bahrain Hospital moving from high secondary care, tertiary care to even quaternary care in certain specialties. We are looking at the option of having a kidney transplant.
Okay.
Yeah, we are talking about starting oncology from a medical oncology aspect as well as surgical oncology. We have started neurosurgery right now.
Yeah.
We may, I mean, in the near future, look at interventional radiology and interventional cardiology. So these are things that we are looking at in Bahrain, plus some expansions in medical centers. But we are looking at one more hospital coming up in Oman. One of our medical centers is being converted to a hospital. And one of our medical centers in Saudi Arabia is being converted to advanced diagnostic center and daycare surgical center.
Okay. So you have your presence in Oman, Saudi, Bahrain, all the GCC?
Qatar and UAE.
Qatar and UAE, all the GCC.
Except Kuwait.
Yeah, I was thinking, except Kuwait. Any plans for Kuwait?
Right now, nothing at the moment.
So you are in a good position to comment about Bahrain's healthcare sector as such.
Yeah.
Do you have the maximum number of centers in Bahrain?
Yeah. Our corporate headquarters is in Bahrain, and
isn't
probably we are strongest in Bahrain. Bahrain was our first home, and probably one of the most encouraging places to have a healthcare business. I mean, traditionally the healthcare was, like you said, you know, most provided by the government sector. There's a lot of private that is coming after 2004. I mean, in medical centers as well as hospitals. Suddenly you see a lot of advent of private hospitals coming.
Yes.
And I think the future is for private healthcare in Bahrain. Especially one of the biggest drivers for private healthcare will be the compulsory insurance that that is coming in, and that will enable a lot of people to access healthcare in this in Bahrain itself. You know, people who were actually traveling out of Bahrain for healthcare will remain in Bahrain because they are enabled, they can pay because the insurance pays for it. And so the COVID actually threw up some inadequacies in the healthcare, especially if you look at the number of ventilated beds in Bahrain.
Yes.
We fell short of that. So the government also has realized that unless they work in tandem with the private, that it cannot improve the healthcare system in general, and there will be inadequacies in future in case of such calamities coming in. So government will encourage the private healthcare sector to come up, even in tertiary care, and we'll see a lot more private healthcare trying to get into tertiary care, like organ transplants, cardiothoracic surgeries, neurosurgeries, cancer surgeries, cancer diagnostics, radiation oncology, and all these things.
Definitely, Bahrain is known for its expat-friendly nature and business-friendly milieu, obviously. And the COVID, during the COVID, I think we saw how step by step private sector was slowly incorporated into the system, isn't it?
Actually, we were probably the only private healthcare facility which was admitting COVID patients.
Yeah, yeah.
Initially, for the government, I mean, the government would send them to us and we would admit. And then there was an option.
That was the new hospital in Umar Hassan.
We had hospital ready
For
even
COVID
before
patients.
it was operationalized to have this. We also ran our ambulances with the national ambulance system because during the second wave of COVID there was a big shortage or big demand for ambulances. We also provided our doctors and nurses voluntarily to help the government workforce in the Sitra ICU, especially during the second wave of COVID. And even now our workforce is doing outpatient screening of COVID patients along with the government workforce in the exhibition center. And so we have been fortunate enough and be part of whatever was an excellent effort from the government in terms of tackling COVID.
Yes, Bahrain's COVID stories is one of the best in the world. I think it's ranked in the top 5. The way they have tackled it, definitely the private healthcare sector played a crucial role, and so did KIMS Health. It's indeed great to see that everyone was together in this battle. And let's take a short break on this note with Jacob Thomas, the man at the helm of affairs of a noted private health brand in the country, KIMS Health.
Our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
Welcome back to BizTalk from BMC Global Live, and with me tonight is Jacob Thomas. Jacob, before we go into a little bit of your personal space and engagements, let me ask one more question related to your industry. Ethics and profit. Though I did touch upon the word business, I asked you how would you comment on the scenario from a business point of view. Let's elaborate a little more on this point. Ethics versus profit is, in my opinion, it's a very thin line in the healthcare sector. How do you look at it?
I think private healthcare, like any other business, has to be run with a profit motive.
Yes.
Unless you have a profit motive, I don't think a business cannot sustain itself.
And the profit means you need more patients.
I mean, there are economics of scale in when you are planning a healthcare facility. You know, you do not plan a healthcare facility out of context.
Okay.
A healthcare facility, when you plan, it should be relevant to the requirements of the population that you're planning.
Okay.
Even in terms of its content, even in terms of its location, even in terms of provision of healthcare services. So that planning has to be properly done. And when that kind of a plan is done, I mean, it will sustain. And like we discussed before, like our values, I mean, which is integral to the success of any healthcare organization. Healthcare should always be done on compassionate grounds. It should be affordable. I mean, cost effective, affordable or cost effective. It should be ethical and transparent. And this creates trust. You know, the question of ethics come when you see patient as a commodity.
Yes.
And then you want to maximize the revenue for everybody who comes in. But at KIMS, we are governed by proper protocols and principles and audit mechanisms in which we ensure that none of our clinicians exceed anything that is required, more than what is required, does anything more than what is required. And when you keep doing the same thing, and that's when you communicate trust to the people. And with that trust, I think the business will perpetuate. And so when that business perpetuates with that kind of a trust, it has the elements to give you profit. So I wouldn't say that earning profit in healthcare is unethical, but how do you earn your profits? If your principles are very solidly grounded, and even within the industry with healthcare insurance providers as well as the people, we have managed to have that kind of a faith with them that anybody comes to KIMS does not get a procedure which is not required or a test which is not required.
Right, okay, well said. And yes, people out there in Bahrain, you don't need an explanation about KIMS, which is founded on compassion. And that's Jacob Thomas as we move into the next phase of this interview. Jacob, did you want to be this in life? Was this your dream profession? Like at the helm of a hospital or?
Yeah, I was meant to be a doctor.
I was about to ask you, why are you not a doctor?
Yeah, I was supposed to be a doctor like my father. My father is a surgeon, and he was also the family doctor.
Okay.
So I was supposed to take over
the mantle, yeah.
Mantle, and so I tried my level best.
Okay.
To be a doctor, but I didn't become.
Do you come from that age when it was the entrance exams?
Yeah,
okay.
I did all the entrance exams that were there, but I didn't even find my number.
Okay.
But I met somebody at that time, quite out of Providence, who told me that you will never be a doctor.
Okay.
But you will be in medical related business. And this was in almost 93, 94.
Okay.
And at that time, medical related business was just limited to probably pharmacies, owning a pharmacy. And I thought, oh, am I going to be a pharmacist? Yeah, but then this is where I am. And just when I finished my graduation, the hospital management options opened up. I was one of the first batches in hospital management, masters in hospital management in India.
Okay.
And I started off my career with Apollo Hospitals. And I was in the projects division. I was looking after many geographies on the projects. I used to have interactions with the chairman of Apollo Hospital and the board members. And after that, I left Apollo and started my own consulting company. That's where I started working with KIMS. And then we are together now.
Okay. Do you regret that you're not a doctor? Are you happy? I'm sure you're happy, but then...
Looking back, I'm quite happy that I'm not a doctor.
Okay, you're happy that you're not a doctor.
Yeah.
Interesting. Jacob, tell us something about your childhood, your school, college.
Yeah, so...
you're from Trivandrum, isn't it?
I grew up in Trivandrum. My dad is a doctor, like I said. My mom is equally qualified, but we are 3 boys, so she decided to be a housewife to ensure that there is some control at home.
Okay.
And I grew up, I studied in one of the best schools in Trivandrum, did my schooling as well as my college in Trivandrum, then moved to Hyderabad for my master's. Then for work, I worked in Delhi with Apollo, Chennai, and then I shifted to Bangalore, where Bangalore is my base right now. I mean, in terms of where I am in India.
Okay.
Though my parents live in Trivandrum.
Right.
Yeah.
Okay. Any other social commitments, engagements? Are you part of any associations or anything in Bahrain? Because Bahrain seen as such that people are involved in social activities.
I'm naturally shy. I would like to believe that I'm an introvert, and I guess, and I do not like to be anywhere on the public or on photographs. Or, And probably this is the first talk show that
Oh, really?
interview that I
Thank
agreed
you
to
so
give
much.
because
I'm
I
honored.
really wanted to change that bit about me.
Okay.
And so I pulled myself out, and I'm here in front of you.
I hope that's a good beginning, yeah.
So, yeah, I'm not actively a part of any association or anything, but support whichever opportunity I have in terms of supporting them.
Okay. Yes, definitely there is a group like you, you know. So from that point of view, how would you define giving back to the society?
I mean, as a group, we believe in giving back to the society. We have a very active corporate social responsibility.
Yes, it's known. The KIMS CSR is
So
definitely known out
we
there.
are part of many camps, outreaches, patient education, screenings. We do a lot of charity, I mean, in terms of even charitable healthcare discounts. We work very closely with the Royal Humanitarian Foundation in terms of taking care of the health of the widows and the orphans.
Orphans, yeah.
Personally, I have, my heart goes out to the Down syndrome, and then we support the Down syndrome society here.
Okay.
And probably we are the only healthcare facility in Bahrain which employs Down syndrome.
Yes, yes. I remember having a discussion with Mr. Adil Fakhru, the chairman, isn't it? And he said, KIMS and McDonald's, some of the select, okay,
So
very nice.
we have them, and we have asked that if they could train some more of them, we could have them here. And then we just not provide them with options of working with us. We take care of their healthcare. We do their audiology screening. If they need a doctor, they need frequent head checkups. We provide all that for them. So it is our endeavor to be part of the society in whichever way we can in terms of taking them along and enriching them.
You said you have 2 children.
Yes.
How old are they and what are their names? Are they watching us now?
I hope they are watching. I told
Okay.
them that. My eldest is a daughter. Her name is Aditi Jacob.
Okay.
She's 16. My son is Joshua. He's 13 years old.
And they go to which school?
They go to St. Christopher School.
St. Christopher School. So Aditi and Joshua.
Yeah.
If you're watching us, it's a hello from Team BMC. Definitely your father's is a bit shy, but then he's giving us the best from his knowledge and expertise. Jacob, what are your hobbies?
Growing up, reading was my the best hobby that I had. I mean, I was a voracious reader.
Okay, so any specific genre or
No,
anything you
I
read?
would
Okay.
read. And even now, reading is switched to online.
Okay.
Whatever time I get, I read. But I do a little bit of motorbiking, both in Bahrain as well as whenever there's an opportunity to do with a group of friends, we travel to some other country and ride. And I play squash and I do a little bit of gym. I like to stay active.
Okay, all right.
That's what I can manage within my time frame now.
All right. So on BizTalk this evening, that is Jacob Thomas heading the KIMS Health GCC. Let's take a short break.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Welcome back to BizTalk from BMC Global Live. And with me this evening is Jacob Thomas, the Group Executive Director of KIMS Health, GCC. Jacob, we come to the close of this chat. I really enjoyed it. Are you enjoying it?
Yeah.
Okay. This is a question which I ask almost all of my guests, because every person who sits on this seat, I find them in some way or the other successful. And every success story has a person behind it who they say. Of course, some people have told me that there are many in their lives. But do you have one such in your life, an inspiration that you may call?
I have also many people, but I guess I can just say two people
Okay.
who are probably the strongest influences in my life. One is my mother,
All right. What's her name?
Grace Thomas.
Okay.
She is probably one of the strongest individuals that I have ever seen. I mean, in terms of any eventuality, the courage to stand, and she taught me that.
Where is she?
She's in my home. I'm in
Trivandrum?
my parents' home in Trivandrum.
Okay. I hope she's seeing it. If not, she must see it later.
Yeah.
This is one of the biggest certificates that a mother can get, you know. Me being a mother, I can really feel that.
Yeah, and she is one person who taught me the importance of future proofing.
Future proofing.
Yeah.
Okay.
She would say that, if you are going to buy something today, buy something that, buy something that is, little bit more than what you can afford today. I mean, stretch it a bit.
Okay.
So that will keep you happier for tomorrow.
Okay.
If you buy just what you can afford today, tomorrow you will be unhappy.
Okay.
I mean, it's not just buying, but in even terms of planning or anything.
Stretch yourself a bit.
Stretch
Okay.
yourself, think ahead.
Okay.
Think of something that will take you ahead for the immediate future or the longer future.
Very nice, because you're active today, and even in terms of health, pushing a bit extra is possible today, isn't it?
Yeah.
Yeah, interesting.
Yeah. So that's something. So anything that even we plan, we'll just not look at, even the businesses that we have, we look at how do we future-proof it. So that's why when you said competition comes, we are okay.
Yeah, okay.
Because we have already future-proofed.
Proof.
We have thought about what we need to do.
Okay, all right.
So that's the importance of future-proofing. I just said it from a point of buying things, but even buying, like if you're buying a fridge, don't buy just a small fridge which you can afford today. Tomorrow your family will grow.
You need a bigger one, yeah, interesting.
So those kind of things, like a car. The other person is our group chairman, Dr. M.I. Sadullah.
Dr. Saudullah, yeah.
The whatever you see me as a core hospital operator is all because of his trust and his faith and his confidence in me and his encouragement.
Okay.
And he has also taught me, you need to confront problems very, very early on. If you don't confront problems very early on, it will come up as a bigger problem much later, which is very difficult. That's one guiding principle which has really become one of my strengths in the last few years. So, and he continues to be my inspiration in terms of whatever we do in
Right, okay.
hospital operations.
Yeah, and we are still early in 2022. People are still setting their goals and way forward and things like that. I think you just said one of yours is to come out and be visible and be a little more on the forefront. Other than that, any other goals? Do you have something in your mind which you want to achieve? Or what are your future plans as a person?
I would say that more from a group.
Okay.
I would say that in whichever markets we are in, we want to be the most trusted healthcare brand. Be it primary healthcare, secondary healthcare, tertiary healthcare, or quaternary care, or home care, or anything. And that's what we are looking at. And we want to look at, in the next 5 years, doubling our revenues and growing wherever there's a potential to grow. And I personally would like to be a part of that growth. And I'm sure the group is capable and poised for that, capitalizing on that opportunity.
Well, Citra is soon opening, is that?
Yeah, within a few months.
A few months. Anything else?
Right now, we're looking at, we've been very, very careful with our expansions, and we would look at always a cost benefit, this thing. And that's why, we don't make too many mistakes, and we are slow in expanding. So, but right now there's something that's off the ground, etc.
Etc. You said next month, isn't it?
No, within the next few months.
Next few months.
Yeah.
Okay, okay. Right. It was very nice having you with us this evening, and the talk was informative and interesting, though you said you're a bit shy. I'm happy to have you on the very first chat show of your life. It's an honor and privilege. I hope that you make to much more of the kind in future. Can I have your wrapping comments, please?
I thank you for the opportunity that you gave to be part of the show. I thank you and the organizers. And I guess there are a lot of people who are hearing this, and I wish a lot more youngsters get inspired by all the people that are coming here and hearing their experience. And I wish the show and you all the best.
Thank you very much, Jacob. Thank you so much. Yes, it is all about patient satisfaction, patient experience, and quality healthcare. That was KIMS Health GCC Group Executive Director Jacob Thomas on BizTalk from BMC Global Live, who was sharing with us the success tale of the brand that he represents. Until we meet next week with yet another guest, this is Raji Unnikrishnan signing off. Good night. Thank you, Jacob, for joining us. And as a token of appreciation, we have a small memento for you. I call upon Francis Kaidarat, the Chairman and Managing Director, and Praveen Krishna, the Media Head of BMC, to give away the tube.
Thank you so much. Hope you enjoyed this day. All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.